we've had challenges. Take, for example, what's happened with COVID. But one of the things that also has given me tremendous pride is the fact that we have been sustained over the years by the goodwill and the appreciation of John Public. We are one of those organizations who have never benefited in large extent from subvention from government. Having said so, we are deeply indebted to government for having made available to us land and property which we have been able to build upon to establish our rehab department, our ECC department and our head office. So the government has helped us a great deal, but we have much to be thankful to John Public, commercial sector individuals, people like yourselves and my family who have contributed in no small measure over a period of time to be able to give us the financial resources with which to be able to accomplish a lot of what we've been able to accomplish. So I am very, very proud of what we have done and the support we've had over the years. But always we need to be doing more, and we also look forward to the government, not the government, but the people of Barbados for helping us to achieve those objectives.
Now we have a lot of cases of NCDs. What's the plan to continue to tackle them and those going forward?
Yes, non-communicable diseases is a very serious challenge for Barbados and a serious contributor to cardiac disease, cardiovascular diseases. And right now the Heart and Stroke Foundation is very engaged with childhood obesity. You would have seen several ads on CBC and in the press regarding what we're doing, working in the schools, trying to educate all of us as to correct diets, the challenges to our health by excessive sugar intake. So we're talking in terms of reducing the intake of sweetened beverages, sugar-sweetened beverages, I beg your pardon. So yeah, NCDs is a major challenge, and we are very, 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 very much involved in it. I may say to you that the head of the Healthy Caribbean is Professor Trevor Hassel, who, with myself, is the founder of the Heart Foundation, and he's very much involved in the spearheading of childhood obesity along with Dr. Anne St. John. So the foundation has not only remotely but very intimately been involved in joining ourselves with the fight for the eradication or the control. I don't know if we'll ever totally eradicate, but the control of NCDs. Letting people realize that no matter what a doctor may do, a lot of your health depends on you. If you are aware of what some of the things that we do, and I know it's difficult, let me say I know it's difficult, and there are certain situations in our community where because of financial availability, people gravitate to providing something for someone to eat, but that something may not always be helpful. So one of the challenges we have is perhaps to work in lobbying with other interested parties and trying to encourage government to do whatever they can to try to make healthy foods more reasonably priced. I mean, vegetables and fruit are not inexpensive, but we need to be able to work with people and to get them to realize, to make an effort. I think a lot more can be done by our sisters and brothers or cousins or mothers and fathers to try to do more for children, because the youth of today are the leaders of tomorrow, and therefore we really need to inculcate in them a desire to want to live better and to look after their health. And I think we've gone a long way. I think we have about 4, 5, 6, 7 schools who are already involved in trying to, as I said, reduce the incidence of sugar-sweetened beverages and to create a knowledge. I remember I had a sister who's now deceased, who was a tremendous smoker. Smoked all night. It really annoyed us. But after she'd given birth to her children, her daughter one day said to me, Mom, I don't like you smoking. And I think that the daughter would have been educated from school. And that stopped her from smoking. So if the point I'm making is that if you can sow the seeds of good health in the minds of the youth, then I think that we are making a tremendous step forward in trying to ensure that the future of our country, the future of our nation is better preserved.